We are going to talk about a novel technique called auricular chromotherapy for treating anxiety and trauma. This technique is fast, effective, and easy to apply no matter how new or old the trauma. It works for both adults and children and is permanent. In 2019, Sheena and I attended the International Light Association Conference on Light and Color for Health and Wellness in Croatia. I was talking about the health effects of electromagnetic pollution and how to reduce electrosmog exposure, and Dr. Assis was giving a workshop on auricular chromotherapy. He's a medical doctor with a specialty in pain management and anesthesiology. Sheena attended his workshop and was so impressed that she learned the technique and is now training healthcare providers on how to use auricular chromotherapy to help those who are suffering from PTSD and other types of trauma. We would like to introduce this technique to you. I'm now going to turn it over to Sheena.
In my work as the director of the Electrosensitive Society, I've realized that often in order to heal, one needs to first reset the limbic system. Before you're able to reset the limbic system, you need to treat any psychological trauma. Trauma results from directly experiencing the event, witnessing in person the dramatic event happening to someone else, or learning of a traumatic event happening to a close family member or friend. Trauma is stored in the limbic system, which is made up of the hippocampus, the amygdala, and the hypothalamus. Consequences of trauma. Immediate reactions such as shock and denial are common, and there is also long-term reactions after experiencing trauma, often including physical symptoms. According to Dr. Assis, trauma and stress interfere with the exchange of information between the two hemispheres of the brain. The left hemisphere is solutions-directed and not sensitive to negative memories, while the right hemisphere stores the trauma and is sensitive to negative memories. To recover from trauma, communication between these two hemispheres of the brain needs to be restored. Both horizontal and vertical integration are necessary, and there are many modalities that help to do this. The one we will talk about today is auricular chromotherapy. Dr. Daniel Assis and his colleagues published this technique in the journal Medical Acupuncture. The authors demonstrated 93% success eliminating trauma with this treatment. Auricular chromotherapy involves the combination of ear acupuncture points, light, and color to treat trauma and anxiety. Acupuncture points are connected by meridians. Acupuncture points have higher conductivity than nearby points and can be accurately detected with an electroacupuncture probe shown here. The acupuncture points on the ear associated with the limbic system are used in this method of trauma treatment. If you press a thumb with a clamp, causing a certain amount of pain, after a few minutes it is possible to identify the corresponding point on the ear, as it too is quite a painful area. A decrease of electrical activity in the same spot can be measured by an amp meter. When the clamp is removed, both the pain and the electrical decrease disappear within minutes. In 2001, Dr. David Alimi, neurophysiologist at the University of Paris, used fMRI to prove the correspondence between the thumb and the thumb point on the outer ear, as the same brain area was activated when simultaneously stimulating both the thumb and the ear point independently. Light therapy has been used for centuries. Currently, light from lasers and LED is used for seasonal affective disorder, for treating skin conditions like acne, and for treating bilirubin in newborns, for example. Different colors of light have different effects and penetrate to different depths through skin. For example, the yellow light used in this treatment has a penetration depth of 2.2 millimeters. Other techniques, such as color puncture, use colored light on acupuncture points. A difference between auricular chromotherapy and color puncture is the color puncture is used on various parts of the body and not just the ear. The lobe of the ear represents the central nervous system and limbic zone. I would like to draw your attention to point 1 on the ear, which is the location associated with the amygdala, and point 2, which is the hypothalamus. Certain points on the earlobe are sensitive when palpated while remembering a significant trauma, phobia, or emotionally charged event. Then a small LED yellow light is used to treat the most sensitive point on the earlobe for 3 minutes. By doing this, trauma victims are able to eliminate their traumas. This technique is non-invasive and does not require the client to share any details of the event during the session. The success of this method is nothing short of miraculous. Here, Dr. Assis is describing his treatment using both the yellow and blue lights on the ear to treat both the limbic system and the vagus nerve.
The representation of the limbic system is in the ear's lobe.
Yep.
The amygdala, hippocampus, and hypothalamus, or always the cortex cingulate, it's here in the lobe. This region of the ear is innervated by the nerves that becomes from the central nervous system. In the concavity of the concha of the ear, I repeat, we have an innervation from the vagus nerve. And then in the limbic system, we put yellow light. And after the treatment, sometimes the patient say, I have some sensation. You have to ask to the patient, yes, I have some sensation here in the chest, in the stomach. Then you put the blue light 1-2 minutes on the concha of the ear. Then you, with these 2 lights, blue and yellow light, you have the device to begin.
So again, it's the yellow light is specific.
Yellow light.
The trauma
region
system, and then the blue light are for the physical sensations, the more physical body sensations.
Yes. Maybe sometimes I have patient that that comes to the cabinet saying, I have an anguish, I am fear here, only sensation, you don't have image. Then sometimes I put the blue light and the anguish is gone.
Really? Auricular chromotherapy is effective with both adults and children. Dr. Assis asks children to draw how they feel about the stressful event. Then the light is shone on their earlobe for 3 minutes. And then after this single 3-minute treatment, they are asked to draw another picture about how they feel. Here are the results. In this example, we have an 11-year-old girl who recently lost her father and grandmother. She suffered from obesity, depression, and has thoughts of suicide. And she is taking antidepressants. Here is the before picture. And here is the after. Notice the connection between them and the use of color in the after drawing. And here, the before picture of her grandmother. And again, after. Notice the connection between the two of them, and again, the use of color, looking into each other's eyes. 1 month later, the same 11-year-old girl had lost considerable weight, no longer had suicidal thoughts, and had a 50% reduction in her pain, in her medication for depression. Here we have another example of a 5-year-old boy whose sister was accidentally trapped in the bathroom. Over time, he developed anxiety about being in small spaces. This became so extreme that he wouldn't go into cars or public bathrooms, and his severe anxiety was negatively affecting his life and that of his family. In his before treatment, he said he felt sad. He asked how to spell sad so he could put the word on his drawing. Then, after one 3-minute treatment, this is his after-treatment drawing. He was surprised that he now felt happy and drew a heart and colored it in red. 3 months later, he was no longer anxious nor emotional in small spaces, and he became less stressed, and his parents noticed this immediately after his treatment. Now I'm going to turn it back over to Magda.
We became interested in auricular chromotherapy because some of the people we work with who have electrohypersensitivity are stuck in a state of flight, fight, or freeze. This can be due to psychological trauma or because of a physiological response, as I will explain. In certain environments, when those with EHS are exposed to electromagnetic fields, they experience some combination of the symptoms listed here, including heart palpitations that may be coupled with pain or pressure in the chest as though they were having a heart attack. We decided to test this using heart rate variability, as some of our research involves assessing EHS and helping people to recover. Here we have subject C, who was exposed to a cordless phone base station in this double-blind, placebo-controlled study. This person was sham exposed during intervals 2 and 4, each of which lasted about 3 minutes. The blue lines represent time between heartbeats. And she was exposed to microwave radiation during intervals 3 and 5, and her heart rate became irregular, only during exposure, with a slight increase in heart rate, which are the red numbers. This person is reactive and is experiencing electromagnetic interference as the cordless phone base station is interfering with her nervous system and affecting her heart. Her sympathetic nervous system, which can be compared to the gas pedal on a car, is upregulated, and her parasympathetic nervous system, which is analogous to brakes, is downregulated. The function of the parasympathetic nervous system is rest, digest, and heal. And when it is downregulated, a person is unable to perform these functions, and that is why sleep disorders, digestive problems, and inability to heal become more critical issues. This person feels as though she is having a panic attack, and her response is physiological and not psychosomatic. Here we have the video demonstration of this impact of wireless technology on an individual with electrohypersensitivity.
Well, 16 by 9 wanted to test the power of Wi-Fi, so we went to visit environmental scientist Magda Havas from Trent University to do another test. Professor Havas' subject, Martin, who calls himself electrically sensitive, is hooked up to a heart monitor, and Havas sets up a wireless computer.
Well, what we're going to be doing is we're going to be taking Martin and exposing him to microwave radiation from Wi-Fi, the same type of thing that we have in schools, for example, and just monitoring his heart to see if his heart reacts to any of the radiation. He won't know when things are turned on or off, so it's going to be a blind study in that regard.
With the Wi-Fi plugged in, Martin's heart rate accelerates in mere moments.
Now I can feel something. It's going through my chest. I feel it down in my legs too.
The closer the router is, the greater his reaction.
A few seconds ago, it was like my chest was actually jumping in the middle here.
Then, seconds after the wireless internet is unplugged, just like that, his heart rate slows down.
Martin, how are you feeling right now?
Fine, I don't think there's anything on.
But listen to this. Those levels Martin was exposed to, well, they're acceptable according to Safety Code 6. So if they're safe, why was his heart racing? Magda Havas has a theory.
So some percentage of the population is reacting to these microwave radiation at levels well below Safety Code 6.
But I'm not sick from Wi-Fi and I use it all the time.
Well, not everyone has the same sensitivities. We have children who have peanut allergies. We have people who are allergic to pollen. They react to pollen. And it's same with electrical sensitivity. Only a percentage of the population react.
These are wireless devices commonly found in the home. Anyone who wants to recover from electrohypersensitivity needs to remove these devices from their living space, particularly from their bedroom where they sleep. It's important to focus on what you can control to reduce your exposure. Once you reduce your exposure to electrosmog, you can focus on resetting your limbic system, as you want to shift from sympathetic to parasympathetic upregulation to help the body heal. Both resetting the limbic system and reducing electromagnetic exposure supports the body and helps it shift towards a parasympathetic state or healing mode. We would like to end our presentation with this 5-minute video where Dr. Assis demonstrates his method on a woman who has just lost her father to a heart attack.
Bueno, fíjate, gírame la cabeza ahí. ¿Duele? ¿Duele?
Sí.
¿Acá?
No.
¿Acá en el borde? ¿Duele?
Sí.
Sí. Ahora gírame de nuevo y fíjate si esto duele más o menos que la otra.
Menos.
Menos. Bien. Tu papá hace hoy una semana que murió. Bien. Cerra los ojos. Gírame un poco la cabeza. Y busca la imagen más terrible que no te puedes sacar, me dijiste. ¿Cuál es la imagen?
La parte que me encontré a mi papá en el baño tirado.
Cuando ves esa imagen en el baño tirado, ¿qué te produce ahora al recordarla?
Dolor.
De 0 a 10, ¿cuánto es? Va a pasar una semana.
10.
Bien. ¿Dónde lo sentís en el cuerpo? ¿En el pecho? Bien. Vos concentrate en esa imagen, nada más, ¿estamos? Concéntrate en esa imagen, nada más. Bien, respira hondo y fíjate en la imagen.
No lo puedo encontrar.
¿Se borró? ¿Y qué ves en lugar de eso?
Nada, el lugar vacío.
¿Estás más tranquila? Bueno, después me contáis. Listo. Bueno, Gisela, ha pasado 8 días. Cerrá los ojos, te pido por favor, y trata de buscar esa imagen que no podía sacarte de la cabeza. ¿Qué ves ahí?
Nada. Está completamente vacío.
¿Y la angustia y el dolor que tenías?
Se pasó.
¿Qué palabras te vienen con respecto a eso que te pasó?
Tenía mucho dolor.
¿Y ahora qué te decís?
Y ahora estoy más tranquila. Como que la paz entró otra vez a mí y la verdad que me siento re bien porque no lo podía conseguir por el hecho de que pensaba todo el tiempo en eso, pero ahora ya no.
Bueno, gracias.
If you'd like more information or would like to learn how to do auricular chromotherapy, please contact Sheena at electrosensitivesociety.com and visit the electrosensitivesociety.com website for more information about electrohypersensitivity, electromagnetic hygiene, and the Rose Lab to learn more about auricular chromotherapy.